Hey guys, and welcome back to my YouTube channel. My name is Onyechi with Nurse Human. Today we're going to be discussing hyperparathyroidism. Now before we go ahead and talk about this topic, don't forget to go ahead and subscribe to this YouTube channel and also hit on that notifications button so you know when I release a new topic. So let's go ahead and jump into the topic of the day, hyperparathyroidism. And we're going to go ahead and break it down so that you're able to understand it a little bit easier. Now, if you don't know, the parathyroid gland, they are 4 small glands that release the parathyroid hormone, right? And they're located behind the thyroid gland in the neck. So, parathyroid, they're located behind the thyroid gland in the neck, and their main job is to regulate calcium levels in the body. Now, the way they do this is by controlling how much calcium is absorbed. That's either by stimulating the intestines to absorb more calcium from our food, or they release calcium from the bones when it's low in the body. So they pull it from the bones and pour it into the blood so that the body has enough to work with. They also regulate phosphate levels, right, by keeping the kidneys from reabsorbing phosphate in the body. Now, I do want to point out here before we move further that calcium and phosphate have an inverse relationship in that whenever calcium is high, phosphate is low, and vice versa. So if we go ahead and break down the word hyperparathyroidism, we already know that hyper means a lot. It means a high level of something. So hyperparathyroidism pretty much means that there is a high level of a secretion of the parathyroid hormone. Now, we already talked about how the parathyroid hormone pretty much works to regulate calcium levels in the body. Therefore, when there is hyperparathyroidism and therefore a hypersecretion of the parathyroid hormone, it causes a lot of calcium to be in the blood, right? So it does this by making the bones to lose that calcium and by pouring them into the blood. So let's go ahead and talk about the causes. Now, the big causes for hyperparathyroidism include renal disease, which is kidney disease, or a person who may have a parathyroid tumor. So that tumor may be sitting on that parathyroid gland and causing it to hypersecrete the parathyroid hormone. So let's go ahead and talk about the signs and symptoms of hyperparathyroidism. Now, patients with hyperparathyroidism, they rarely show signs and symptoms, but when they do, let's talk about some of the things that we might see. Now, a patient with high level of calcium in the blood can lead to calcium-forming kidney stones. Another thing we see is we already know that this hypersecretion happens by pulling calcium out of the bones and into the blood. And so these bones are left to be with less calcium, and it's causing bone and joint pain, muscle weakness, and fatigue. Another thing we see is high level of calcium also leads to low level of phosphorus. Why? Because I told you before, there is an inverse relationship between the both of them. And other symptoms you might see the patient complain about include nausea, vomiting, abdominal pain, and constipation, which, as you know, these all go hand in hand. So as the nurse, what is your responsibility? If you had to think of those signs and symptoms we just talked about, what would you want to do for your patient as the nurse? The first thing is you know that this patient is at risk for constipation and kidney stones. So you want to help increase their hydration. So as the nurse, you're going to be making sure that patient is drinking good fluids throughout the day. And we're talking mostly water because that's actually what hydrates you. We want at least 2,000 mLs of water a day. And it might seem like a lot, but we're trying to prevent the side effects of this condition. Another thing is a low calcium and vitamin D diet. We already have a hypersecretion of calcium, so we don't want more calcium. And a low vitamin D diet is because vitamin D is essential for calcium absorption. So we don't want any more calcium absorbed. We're trying to reduce how much we have. So we're encouraging a low calcium and a low vitamin D diet. Now we're also going to strain the patient's urine because we want to catch any of those calcium forming kidney stones. If this patient have kidney stones, they might complain about pain, and so we might start to actually strain the urine to see if we catch any kidney stones in there. Now the patient is having bone pain and joint pain because a lot of that calcium is being pulled from the bone and poured into the blood, and so make sure that you have this patient on fall risk precautions. Make sure you have the call light beside the bed or on the patient's bed. Make sure that the bed is all the way down. Make sure that the room is well lit. Make sure that you're letting the patient know to call for help if they need to go to the bathroom. Make sure we don't have any throw rugs, any cords that could trip the patient. All of those things you would do as a nurse in a hospital to prevent a patient from having a fall. And then lastly, you want to monitor the vital signs, and especially monitoring those electrolytes such as the calcium, the phosphorus, and the vitamin D. So I hope this helps you to understand this topic better as you encounter hyperparathyroidism in your nursing school education. I hope that you are able to grasp what is going on by going through this PowerPoint. I have so many other PowerPoints that are going to be coming out, so go ahead and subscribe to this channel and share this channel with another nursing student that might find it beneficial, because that's how you help me to make more of these PowerPoints. Most especially, make sure that you hit that notification button so you know whenever I release a new PowerPoint series, and also make sure that you like and you comment if you have any questions, any concerns, or honestly any corrections that you want me to take note of. I look forward to hearing from you, and I thank you for staying till the end of the PowerPoint. Till next time, have a wonderful day.